Sarah stared at her reflection in the bathroom mirror, but the face looking back felt foreign, like a stranger wearing her features. Her hands trembled as she touched her cheeks, desperately trying to reconnect with the person she knew herself to be. This wasn't the first time she had experienced this unsettling disconnection from her own body and mind. For months, Sarah had been living with what mental health professionals call depersonalization/derealization disorder, a condition that makes individuals feel detached from themselves and their surroundings, as if they're observing their life from outside their own body. Depersonalization/derealization disorder represents one of the most misunderstood and isolating mental health conditions in contemporary psychology. Those who suffer from this disorder often describe feeling like they're living in a dreamlike state where nothing feels real or substantial. The world around them appears foggy, distant, and artificial, while their own thoughts, emotions, and physical sensations seem muted or completely absent. This persistent sense of unreality can be profoundly disturbing, leading many individuals to question their sanity and struggle with intense feelings of existential dread. The disorder manifests in two primary ways, though they often occur together. Depersonalization involves a sense of detachment from oneself, where individuals feel disconnected from their thoughts, feelings, body, or actions. They might feel like they're watching themselves from outside their body or that their limbs don't belong to them. Their emotions may feel dampened or completely absent, creating a sense of emotional numbness that can be deeply distressing. Derealization, on the other hand, involves feeling disconnected from one's surroundings. The external world appears unreal, dreamlike, or distorted. Familiar places may seem foreign, people might appear robotic or artificial, and the environment may feel like a movie set rather than reality. Understanding the underlying mechanisms of depersonalization/derealization disorder requires examining both psychological and neurobiological factors. Research suggests that the condition often emerges as a protective mechanism during times of extreme stress, trauma, or anxiety. When the mind becomes overwhelmed by intense emotions or threatening situations, it may essentially shut down certain processes to protect the individual from psychological harm. This dissociative response can become habitual, occurring even in non-threatening situations, leading to the chronic symptoms characteristic of the disorder. Neuroimaging studies have revealed fascinating insights into the brain activity of individuals with depersonalization/derealization disorder. Scientists have observed decreased activity in areas of the brain responsible for emotional processing, particularly the limbic system, which includes structures like the amygdala and hippocampus. Simultaneously, there appears to be increased activity in prefrontal regions associated with emotional regulation and self-monitoring. This neurological pattern suggests that the brain is essentially dampening emotional responses while heightening analytical observation, creating the characteristic feeling of being a detached observer of one's own life. The triggers for depersonalization/derealization disorder are varied and often complex. Traumatic experiences, particularly those occurring during childhood, can predispose individuals to developing dissociative symptoms. Severe stress, panic attacks, depression, anxiety disorders, and substance use can all serve as catalysts for episodes. Some individuals report that their symptoms began following a specific traumatic event, while others describe a gradual onset during periods of prolonged stress or emotional turmoil. Interestingly, the condition can also be triggered by seemingly minor events in individuals who are already vulnerable due to underlying psychological factors. Living with depersonalization/derealization disorder presents unique challenges that extend far beyond the primary symptoms. The chronic sense of unreality can make it difficult to form meaningful relationships, as individuals may feel disconnected from their emotions and unable to fully engage with others. Work and academic performance often suffer, as concentration becomes difficult when one feels detached from their thoughts and surroundings. Many individuals develop secondary anxiety about their symptoms, creating a cycle where fear of experiencing depersonalization or derealization actually triggers more episodes. The social isolation that often accompanies this disorder can be particularly devastating. Friends and family members may struggle to understand the nature of the condition, sometimes dismissing symptoms as attention-seeking behavior or suggesting that the individual simply needs to snap out of it. This lack of understanding can deepen the sense of alienation and make recovery more challenging. Many individuals with depersonalization/derealization disorder report feeling like they're living behind a glass wall, able to see the world but unable to fully participate in it. Treatment approaches for depersonalization/derealization disorder have evolved significantly as our understanding of the condition has improved. Psychotherapy, particularly cognitive behavioral therapy and dialectical behavior therapy, has shown promise in helping individuals develop coping strategies and address underlying triggers. These therapeutic approaches focus on helping patients recognize and challenge distorted thought patterns, develop grounding techniques, and gradually reconnect with their emotions and physical sensations. Mindfulness-based interventions have also proven beneficial as they help individuals develop a more accepting relationship with their experiences while learning to observe their symptoms without becoming overwhelmed by them. Medication can play a supportive role in treatment, though there are no drugs specifically approved for depersonalization/derealization disorder. Antidepressants, particularly selective serotonin reuptake inhibitors, may help address underlying depression or anxiety that contributes to symptoms. Anti-anxiety medications might provide short-term relief during particularly difficult periods, though they must be used carefully to avoid dependence. Some individuals find that medications targeting other conditions, such as mood stabilizers or antipsychotics, can help reduce the intensity of their symptoms. The journey toward recovery from depersonalization/derealization disorder is often long and requires patience, both from the individual and their support system. Progress may be slow and nonlinear, with periods of improvement followed by setbacks. However, with appropriate treatment and support, many individuals do experience significant improvement in their symptoms and quality of life. Learning to manage the condition often involves developing a toolkit of coping strategies, including grounding techniques, stress management skills, and lifestyle modifications that support overall mental health. Support groups and online communities have become invaluable resources for individuals with depersonalization/derealization disorder. Connecting with others who understand the experience can provide validation, reduce feelings of isolation, and offer practical advice for managing symptoms. These communities often serve as bridges between professional treatment and daily life, providing ongoing support and encouragement throughout the recovery process. As awareness of depersonalization/derealization disorder continues to grow, researchers are working to develop more targeted and effective treatments. Studies exploring the neurobiological underpinnings of the condition may lead to new pharmaceutical interventions, while advances in psychotherapy techniques continue to improve outcomes for patients. The integration of technology, including virtual reality and biofeedback, shows promise for creating innovative treatment approaches that can help individuals reconnect with their sense of self and reality. Sarah's story, like those of countless others living with depersonalization/derealization disorder, illustrates both the profound challenges and the potential for healing that characterizes this condition. While the journey toward recovery may be difficult, understanding, appropriate treatment, and support can help individuals reclaim their sense of self and reconnect with the world around them. The key lies in recognizing that depersonalization/derealization disorder is a real, treatable condition that deserves compassion, understanding, and comprehensive care.